to Meddkit's Provider Spotlight, where every week we are interviewing the most amazing private practices from all over the United States. Every week we come here and we get to talk to someone brand new, new specialty, but most importantly, we get all different kinds of perspectives. And, with the way the world of healthcare is, there is a lot going on. There's a lot to always learn. And so today we have a really special guest for you. I'm really excited to introduce you to Dr. Elliott Perel. He is the owner of Monroe Foot and Ankle Care in Jamesburg, New Jersey. Welcome, Dr. Perel. Thank you so much for being here.
Thank you very much, Rachel. It's glad to be here.
I'm very excited to dive in. And something that I typically like to do in the beginning here is I think everyone wants a good chance to get to know you. And so I always think people are impressed with hearing about the origin story. What inspired you to open up your own practice? What got you here?
Well, after my residency, I did a continuing medical education program. I did a surgical preceptorship in Manhattan at Manhattan Podiatry Associates
Mhm.
in Midtown Manhattan. We had two OR suites there, and we also I was a surgical assistant at the Fifth Avenue Surgery Center, and I was helping out a lot of the top foot and ankle surgeons around the metropolitan area. Well, it was a very busy practice, and I was working very long hours. And we just had well, my wife was pregnant at the time, so I decided I need to go to the suburbs so I could get home and be with my new family. As much as I loved practicing there and seeing a lot of very famous people and treating well-known people in that area, I moved to Jamesburg, New Jersey, because my sister-in-law was a chiropractor here and invited me to uh, join her office at first, and then I wound up growing quicker than expected because there was three podiatrists in town, but I was the only board certified foot surgeon at that time. So we did grow a lot. We moved to a bigger office within 8 months.
Wow.
And since then, I've been to two other offices, which, but I'm still in Jamesburg, which, if you don't know the area, we call ourselves Monroe Foot and Ankle Care because that's Monroe Township is the larger town, and it's consider it the donut. Jamesburg's the donut hole, 1 square mile right in the middle of it. So we do go by Monroe Foot and Ankle Care.
That's awesome. What a great story. I mean, it's nice that you were able to make such a great shift and grow your business in such a short amount of time. I always love hearing the origin story. What got you interested? What got you to open up your practice? So that is very, very cool. Something that I'd love to ask you is, I think there's always more than what meets the eye in podiatry and foot and ankle care. So I would love to hear about some of the common areas that you treat and find people struggling with. But maybe you could tell me a little bit about some of maybe the uncommon things or things that people may not know about what podiatrists do.
Yeah, a lot of people don't know what podiatrists are. Actually, I'll give you my full origin. I didn't know anything about podiatry when I started college. I was on the pre-med path,
Hmm.
and our pre-med advisor was very gung-ho about podiatry. He was calling it the profession of the future for the new millennium. You're too young for this, but in the 80s, 70s and 80s, jogging was a huge trend. So we were going to have all these runners with problems later on. I was a collegiate wrestler, and one of my teammates got injured, hurt his ankle, and they said take him to the local foot and ankle doctor. And I happened to have a car on campus. So I took him to a local podiatrist in upstate New York, and he was a great guy. He heard I was pre-med and invited me back to his office, and I watched him treat athletes from all the teams in the school, and I got to visit him. And then I come home and I wound up, my mother just went to a podiatrist for a foot issue, and so she brought me to a podiatrist. So it really, like, it was meant to be. And then people were telling me about the profession as I went. So I decided to go to that path. Now, things that are unusual. What people don't understand is podiatrists treat any and everything of the foot and ankle. Sometimes we're just a gatekeeper.
Hmm.
Actually, about 5, 6 months ago, I found squamous cell carcinoma, cancer, underneath a toenail.
Oh,
Now, I'm not treating that myself, I did a biopsy, then I would send it out to a surgical oncologist. So sometimes with a gatekeeper, we see something, we move it over. But we treat fractures, we treat Achilles injuries, ankle injuries, structural problems, gait issues, instability issues. Of course, most people know us for toenails, for corns, for calluses, but we treat their causes too.
Mm.
So we treat any and everything of the foot and ankle, is what I always like to say.
That's a really good way to describe it. And it's amazing though. I mean, never, obviously have done so many of these interviews. It's amazing to hear some of the providers that you wouldn't expect to say something, you know, I just saw a patient and, they actually had, cancer. And because I read their labs, which t maybe typically people in my field don't do, depending on who they are, or a different type of thing that they're doing, it's amazing to see that yes, you can indeed save someone's life and maybe they've overlooked something and you're addressing the root cause of it so that it doesn't happen again. And so I think I love the way that you describe, what podiatrists do and specifically what you do because I think people tend to, as you said, gear towards, toenails or other things, but that's actually, I wouldn't say small relative to what you do, but there's such a wide range of what you do.
I would say I'm also a screener. I can't count how many times I've found peripheral vascular disease that people could have lost their limbs. And I have a very good relationship with a couple of vascular surgeons that I'll send them to right away. Now, the patient will tell me they saw their primary care doctor a month ago and it was missed.
Wow.
So when they come in, I can't see the pulses. Find cold feet. I find other signs or symptoms showing peripheral vascular disease. So I send them to the right person. We get treated. I've treated people. I'm sitting in there for a toe problem, and I look at their lips and notice blue lips. And I start talking to them about had their breathing problems, and I've sent them on, and we found other problems that probably saved them because they didn't see their physician for 6 to 8 months. So they came into me for a problem, and it
Right.
was a good thing that we look. I love to play detective. I love to see a symptom and try to find out what it is. And if I don't know what it is, I'm going to send it to somebody who does. I believe in specialists.
That's amazing. I love the detective work. I think everyone should see a physician that is like one. So many times things are missed, like you said, and I'm sure it feels great to catch. I mean, it's unfortunate you don't want to catch something, but it almost feels great when you do because then you can help that person on their way. So I think that's fantastic. Is there something that you would say that makes your approach different than other podiatrists that are in the area or across the country?
Well, experience now, I've been in 30 years. I used to let the patient guide me more, and now I don't. Somebody comes in with a pain in their foot. They'll tell me about an accident they had 13 years ago, and that once in a while will happen, and they'll start leading me down this road. I used to just follow their lead. And now I'll say, so it's been hurting you consistently for 13 years? Oh no, it hurt me for 3 months and now hasn't bothered me for 11 and a half years or 12 years. So we'll find out it had nothing to do with what they're talking about. So sometimes you have to start asking the right questions and don't let the patient lead you. Let them tell you their problem. And you ask the question, was there any trauma? Okay, that could have had something to do with it, but it's not what's happening now. Just because you had a foot injury 15 years ago doesn't mean that's what's causing the problem now.
I really like that approach. I think and sometimes, which kind of guides me into my next topic, there is a lot of misconceptions. People read things online. We have Google, ChatGPT, WebMD, which I'm sure a lot of, people are happy that, you're invested in your health, but at the same time, wrong resources or that wasn't the right article. You need to read, some other things. I'll give you some literature on it, So there is a lot of information out there, but I love how you're still, let me ask you the questions and you tell me the answers, and I'm gonna play the detective and put pieces together. But would you say there's other misconceptions to, the podiatry field, aside from what you had mentioned before, is there anything that people come in with and they say, oh, I read this or I read that, and you're like, where did you get that from? You know?
Oh, one of the most common misconceptions about our field is we're like the old timers, which I'm getting there, but a lot older than me, who weren't hospital based trained, that didn't trained in surgical techniques and really just treated toenail issues and corns and calluses. So they didn't have the hospital training. They didn't do emergency room or neurology or radiology or dermatology rotations or internal medicine, even.
Yep.
Um, so a lot of the old timers, the guys who trained in the 60s, 70s, and even early 80s, were more like that. In the 80s, actually, residencies became a bigger thing. And now it's mandatory 3-year residency for every podiatrist. So I'll even have physicians that will contact me and say, what made you look at that? How would you know that? Like,
Yeah.
because I was trained at Wyckoff Heights Medical Center where I did my program, and we went through those rotations. And so it's a misconception even among other doctors. They'll So there are foot and ankle orthopedists who specialize in foot and ankle, but
Mhm.
they'll send them to somebody who does knees and hands instead of a podiatrist who's doing this all day long. And I never understand this because as much confidence as I have in those doctors for my knee problem, for my hip problems, for my shoulder. But if I went to a shoulder specialist and said I had a back problem, he would send me to somebody else. That's
Yeah.
not who you should be seeing. You see the specialist for the problem you're having. And almost anyone I know in my profession knows when it's something they don't deal with commonly and refer it out. I don't do a lot of, well, I haven't in years doing ankle replacements. I
Yeah.
would send that out to somebody who does that.
Right.
We do what we're comfortable because also that came way after my training and it became a thing. But we know what we know and we're really good at it.
I love that approach. It is so simple. It's like, this is what I know, this is what I'm really good at. See a specialist for the issue that you're having. I'm going to send you off to this person. If you're having a shoulder problem, I'm not going to send you to the person that does hands and, or knee, like I need you to see the specialist for the problem that you're having. And so I like that approach because I think oftentimes some of the things get muddied a little bit.
Well, one of the most common things is I love pediatricians. Like when a pediatrician refers, they're our best source because parents think of them as godlike. If my pediatrician referred to you, you must be good. But pediatricians tend to tell their patients or the patient's parents they'll outgrow it. And the reason they tell them that because they're not going to see them. The kid's flat-footed now and complaining about pain, you may get used to it and not talk about it, and that leads to problems later on in life. Meanwhile, I see them in a simple pair of orthotics every couple of years, a new pair every couple of years that could control abnormal motion and give them stability, could make their life a lot easier.
I agree. Having heard that growing up,
Yeah.
you'll grow out of it.
You'll grow out of everything because when you're 18 or 21, you're out of the practice. So you grew out of it.
Mm. That is, something often that we talk about here, and a lot of the private practices that we see, we talk about medical gaslighting quite a bit because, you're experiencing a problem and you're told things like that and to move on for it. And I love your approach and playing the detective and say, you know what? That's not quite true. That's not, we can help you so you don't experience this pain or especially as a young person, like there's so much that you could set right so that when they do grow older, that things aren't quite set in place and, you can help them at a younger age so that they, grow older, maybe don't have some of the aches and pains that we have,
Yeah.
So that I think that we got to get you talking to more pediatricians. That's great. It's really good to know. To help actually round out today, speaking of, you've given us so many great ideas, tips, and advice, and I'd really like to ask you, is there something that you might give to a patient for whether it's common homework, or things that they can do to, move their health in a better trajectory? Is there something that we can do every day that would better our foot, ankle health? That I think that would be really great to hear.
I'll give you two of my favorite things.
Okay.
One is stretching. Stretching is key to prevent a lot of injuries. Um, you've heard of the weekend warriors, especially people. You get guys like me. Let's say we were athletes in our younger day, and then you take some time off, and then we move on to something. And this goes, women as well. I didn't when I said guys, it
Hmm.
goes for all genders. Um, and then we start doing something like I play basketball. I play basketball with men my age, and we have had a number of injuries because they spend 3 minutes stretching like they did when they were 15 years old, when you
Yeah.
were flexible, and now all of a sudden the injuries happen. So that's one. Stretch, stretch, and stretch again is the way I tell a lot of people, especially like heel pain, plantar fasciitis. If we could stretch our calf muscles, our hamstrings out, all those posterior muscle groups, that will really help a lot to prevent that. And the second thing is stability. And I firmly believe in orthotics. If you don't know what that is, they're custom made um, inserts, not arch supports,
Mhm.
because they're made to your arch that go into your shoe and control abnormal motion. There are more than 25% of all the bones by all the bones of the body are in the feet. And that's a lot of motion that comes with all those joints. So
Yep.
good orthotics stabilizes you and makes you walk better. It gives you more control. It doesn't allow these abnormal motion that could lead to a lot of problems, such as bunion, hammer toes, neuromas, Achilles injuries, tendon injuries, non-traumatic injuries. I'm talking about, and just a simple pair of orthotics. Not all insurance companies cover it.
Hmm.
They should, but if you could afford them, if they're not covered, they are well worth it. I can't go anywhere without my orthotics, and I'll say the same thing for most of my family members.
It's amazing. Just the small little tweaks in life, and that's why I love asking this question is because there's so many things that we can often do for our health that take minimal time. Things that if we just took the 1 second to do, maybe if, we are on that basketball court about to shoot some hoops, and instead of thinking about that we're LeBron James, that, we can do a couple of stretching and then not, end up in a bad place and continue to
Well,
play.
that's not a great example because he just got hurt.
Yeah. Oh, yeah, he did. Yeah. Well, poor LeBron. Sorry,
Jason
LeBron.
Tatum stretches, he's stretched out by professionals and he still ruptured his Achilles. Now these things happen.
Yeah, no, they do. Accidents happen. You move in the wrong way, you pivot in the wrong way. Anything can happen, but if you can do something to at least help prevent
To
the more,
minimize it, to,
yeah,
to make it,
minimize it.
yeah, to not make it as common. If you stretch out enough, it'll be a lot less common.
Yeah, I agree. An interesting question would be, have you seen a correlation, with everything that happened with COVID? Obviously, things were shut down. A lot of athletes couldn't play. Have you seen an actual uptick in injuries since then? Because, people, and as we're having sedentary jobs, have you seen in the past, maybe 5, 10 years that people are more injury prone or having, more issues? That they did and maybe 20 years ago, say.
Now, I almost hate to say this because even though I don't play frequently,
Yeah,
pickleball became a big sport in the last
a-
few years.
absolutely.
I probably see more pickleball injuries than I do any other sport right now. And it used to be basketball by far, and then soccer. But pickleball, we just see so many injuries now. And a lot of people, I've had a few young pickleball players come in with injuries, but very few. But it's always people 50s, 60s, 70s that come in that got injured playing it. So you really got to take it easy. And I've only played about twice in the last year, but I used to play about, you know, every week I would play.
Yeah.
And I watch people come in and they stretch against the fence for about 30 seconds
And that's it. Oh, I think we lost your audio, Dr. Perel.
Is that good?
Yep, I can hear you now.
Okay. I don't know what you missed, but I just said after they stretch for 30 seconds, they think they're ready to go.
Yeah, it's interesting that you bring that up because I think, one, it's become wildly popular, and I think a lot of people, also kind of hitting on a myth is that, I don't think a lot of pickleball players know to see a podiatrist or see someone that is specialized in foot and ankle. Maybe they're thinking about elbows or other things, but as they're on their feet a lot and maybe picking up a new sport, a lot of new people are trying this, things can happen. The muscles that they're weren't, using before is now they're very much using. And so, I think that's a great testament to, seeing someone new to help your specific problem. So,
That what we were talking about orthotics before. That's a perfect example. People will spend $200, $300 on a great racket. They'll buy the best shoes where they think court shoes
yep.
and pick up a good pair of orthotics that could control abnormal motion, and that could help you so much prevent injuries and the pain when you walk off of the court that you have 2 hours later. That could have been prevented. That's foot fatigue because of intrinsic muscles overworking, and that could be controlled with stabilizing the foot.
100%. I think I love this is the greatest tip. So orthotics, stretch, see specific people for your specific problems. I love it. I think this was fantastic getting to know you, hearing your story. The advice that you have given us is invaluable. What I'd love to do before we leave off today is if you can tell folks, how they can reach out to your office and either set up an appointment or maybe it's someone else, a physician that is saying, "Hey, Dr. Perel's got it right. I'd love to connect with him." Can you tell us the best way to do that?
Great. I'm a people person. I'd always love to speak to somebody. So if they want to reach out, fine. My phone number is 732-521-2155. My website is foot-ankle.com. I think I'm supposed to say the www dot first, but www.foot-ankle.com. And we are located in Monroe Township, New Jersey. If people reach out and need somebody that are further away, I know a lot of other podiatrists that I could always recommend. We I think we're on Instagram and Facebook. I know we have a foot Facebook page, Monroe Foot and Ankle Care, where we put tips regularly. Um, and that's basically how you can reach us.
Awesome. Well, thank you so much, Dr. Perel. This has been a pleasure, and we hope to have you on again.
Very nice speaking to you, Rachel. Thank you too.
Thanks.